30 million Americans deal with an eating disorder of some kind, and this week has been declared National Eating Disorder Awareness Week to make sure people are talking about the problem and to give people some help if they know someone who's struggling. 9 News medical expert Dr. Kohli here to talk about it this morning. So how about 2 questions for starters? Number 1, are bulimia and anorexia still the 2 most common forms of eating disorders? And just how serious can these eating disorders be?
You know, Drew, it's interesting. We've seen a shift away actually from anorexia and bulimia to more of something called binge eating disorder, where a lot of people binge as a way to emotionally cope, and then they don't have the compensatory behaviors that you see in bulimia. So in bulimia, when you binge, you feel guilty enough that you purge in some way. You vomit or you induce, diarrhea with laxatives. But in binge eating disorder, which is much more common in Americans, you just use it as a way to cope with emotions. You feel guilty afterwards, but you're not necessarily purging. Now, anorexia, of course, is where you have restricted eating, mainly driven by body image issues. But the reason the eating disorders are such a big deal, and I'm so glad we're talking about them, they're psychiatric illness that's associated with the highest risk of dying because they can cause arrhythmias, they can cause electrolyte problems, all sorts of things, and they're under-recognized.
Are we seeing an increase in eating disorders?
Unfortunately, we are, and it's been sort of steady since the pandemic, and we think part of it is driven by social isolation and loneliness, but part of it is really this social media culture, this emphasis on how we look in our bodies and biohacking and wellness and being perfect. And what we've seen is that it's actually shifted this awareness of our bodies and how we look much more into the adolescent space when our brains are much more susceptible to develop psychiatric illnesses as well. So we're starting to see a lot younger people develop eating disorders. And there's many different kinds, actually. We talked about anorexia, bulimia, and binge eating, but there's even a new one that's not a formal eating disorder yet, but it's called orthorexia, which is that you have an unnatural obsession with healthy eating. And if you don't eat clean food, pure food, or healthy food, you either restrict or you feel incredibly guilty if you have a hamburger. You just can't cope with the psychological distress that that causes. So that hasn't formally made it into the DSM-5 diagnosis yet, but it's coming because of this wellness and biohacking culture that we see.
There has to be influences to all this, but I'm wondering about genetics. Are some people just more naturally susceptible to having an eating disorder?
There's a huge genetic influence. So this is something I didn't even actually realize just how big it is. But if you look at twin studies, if you have a first-degree relative with anorexia, you have a 7 to 12-fold higher risk of getting it. So 50 to 60% of it is heritable, so to speak. And with bulimia, also 50 to 60% heritable, 4-fold higher risk if you have a family member first degree who has it. Now, it's not a single gene. It's actually probably multiple genes. We think appetite genes, reward genes in our brain, anxiety, depression genes, our coping genes, our perfectionism genes, a whole bunch of things that set you up for this. And then it sounds like something in the environment triggers it. So not everybody who has a predisposition gets it. And it's usually that, like I said, the wellness culture or trying to impress others or keep up with others or this focus on how our bodies are looking.
What are some of the signs that families should look out for?
So here's what's interesting is it's not always somebody who's low weight. That's only really in anorexia. In bulimia, you can actually see people normal weight. And in the binge eating disorder, you can see people even overweight because they end up eating a lot. So that isn't always a great clue, but I really want you to look at the behavioral and sort of psychological relationship with food. So are they eating in secret? Are they saying comments after they eat about how they feel about the eating? Are they asking a lot of questions about where the food came from, what's in the food, what the caloric intake is? So really how they interact with the food and then how they behave afterwards. Those can be sort of the earliest clues. Sometimes if somebody's losing a lot of hair, they're looking abnormally thin. Of course, in anorexia, these can be signs as well. But with eating disorders, the earlier you diagnose them, the better the prognosis and the better the recovery. So it's really important to get a handle on them early.
That's like most things, right? I am curious, once you establish, okay, there's some warning signs here, do you have any advice for how to approach that person? How do you talk to them about this?
So you bring it up as uncomfortable as it is, and you be prepared for ambivalence or getting brushed off or defensiveness, because that's what people with eating disorders do. They lack insight, and even if they have insight, that gives them guilt in and of itself, so they don't necessarily want to talk about it. But you do it in a way that's non-threatening, non-attacking, non-policing, so you don't judge them, you don't say, what's wrong with you, why are you doing this, you have to eat this food. That's not the way to do it. The way to do it is just sort of open the door and say, I've noticed that you feel guilty after you eat a big meal. Do you think that that's how you cope with your emotions. And then make sure you get them plugged into help, because cognitive behavioral therapy, especially in our adolescents, but even young women, young men, incredibly effective way to rewire that circuit in our brain. Eating disorders are something people struggle with probably all their life, so they wax and wane. But again, the earlier you can help them to get a handle on how to deal with those emotions and thoughts and feelings, the better that they'll do in the long term.
I mean, some of these eating disorders are newer, but eating disorders are nothing new in general. I know there's a plethora of information online to help with these conversations and get your family help if you're kind of seeing some of the signs and symptoms as well.
Absolutely. National Eating Disorders Association has a whole bunch of resources that have tests on there, even ways that you can self-diagnose if you think you might have something like this.
Dr. Kohli, we always enjoy having you on the show. Are you scheduled to come back later this week?
I am later today, actually.
Well, how about on our show? How about on our show in the mornings?
Not till next week.
So be it. Thanks.